Hello there, my name is Marvin Music, and it's a privilege to have you with us today during this session about Medicare insurance. Now today we're going to be discussing the key differences between Medicare supplemental plans versus Medicare Advantage plans. We want you to know how to choose the right plan so that you will not regret it later. Now most people don't realize it, but the average 65-year-old couple will spend $560,000 on healthcare costs during their retirement years. Now, folks, that's a large and staggering number. And which insurance plan you choose will determine how much of that money is actually spent out of your pocket or the insurance company's pocket. Now, I'm sure you would rather that money come out of their pocket instead of your own, and I'm going to show you how to do that today. So let's get into the details of these two options that everyone must choose from as they begin to use their Medicare benefits. You see, there's only two options for Medicare coverage. Option number one would be for you to stay in what we call the original Medicare system that began in 1965 that is called A and B. The other option is to do a Medicare Advantage plan. This system actually began in 2003. And so these are the two options. Now, if you decide to stay in the original Medicare system, you will, in addition to having A and B, you will have to have a Medicare supplemental plan. A supplemental plan that will be bought through a private insurance company to cover in the gaps that Medicare does not cover. In addition, you'll have a standalone drug plan, which means your prescription drug coverage will also be through a separate plan. Instead of being included in original Medicare A and B or the supplemental plan, you'll have this standalone drug plan. If you decide to go with the Medicare Advantage plan, you'll also have drug coverage, but that Part D plan will be actually included within the Medicare Advantage plan. So these are the two options before you. So what I want to examine first is if you decide to stay in the original Medicare system, how does that work? Well, of course, you know Medicare has two parts, Part A and B. Now, Part A is called hospitalization insurance. And for 99% of all people that are going on Medicare, there is no premium cost whatsoever for Part A. The reason for that is because you've been paying Medicare taxes all of your life. And as long as you have at least 40 quarters accumulated, then Medicare will not charge you anything for your Part A hospitalization. Part A hospitalization has no networks at all, which means that as long as the hospital that you desire to go to takes Medicare money, then you're eligible to go to that hospital. So no networks. Now, as far as Part A coverage, it includes everything that relates to inpatient hospital care, which means you've been admitted to the hospital. Part A will pay the bills for that. In addition, skilled nursing facility, which is really nothing more than inpatient rehab. A doctor could send you home for a home health care, could send you to an outpatient clinic, or can admit you. And when you're admitted for rehabilitation, that's called skilled nursing facility, and Part A will pay the bills for that. Home health care. This would be follow-up after probably a surgery or some kind of an inpatient stay. A doctor says you really don't have to go to skilled nursing, and we're not going to send you to a clinic. We're actually going to send you home. And then the Medicare-approved home health care agency will do the follow-up, and Part A, again, will pay those bills. In addition to that, hospice. This is for those that are diagnosed with a terminal illness. All the hospice bills will be paid by Part A. And so those are the main items covered by Part A. Now, financially, here's what it looks like. If you're hospitalized, this year it will cost you $1,316. That's in the form of a deductible, which means you pay the $1,316 and then Medicare will begin to pay all the other expenses. Now, this deductible is unlike most. Most deductibles today are an annual deductible. This is called a benefit period. And a benefit period begins when you're hospitalized and then you're discharged, and that benefit period continues on for a full 60 days after your discharge. So if you are re-hospitalized during that 60-day period of being discharged, you go back to hospital, you're under the same deductible and you would not have to pay this again. But if you're discharged and nothing happens during that 60-day period of time, but happens afterward, then you would actually pay this deductible again. So this deductible is subject to being paid, 2 or 3 times in a year. And so that's a per benefit period deductible this year, 2017, of $1,316. That deductible will be your full financial responsibility to the hospital for up to a 60-day stay. So it doesn't matter if you're in 1 day or 2 days or 10 days or 60 days. And it doesn't matter how size the bill actually is. The $1,316 is all the hospital will bill you for the first 60 days. If you're in the hospital after 60 days, Medicare will cover you actually for 3 more months. The third month there is actually $329 a day, and then months 4 and 5 are actually $658 a day. So we have daily copays. We call these extended United States. The good news is they are very rare, but when they do occur, this is how Medicare will bill them. Skilled nursing facility is also covered, of course, by Part A, and Medicare says that as long as you've been in the hospital 3 days or longer, the first 20 days in skilled nursing will be at no cost to you. They will pay all the expenses. If you're in longer than 20 days, then Medicare will charge a daily copay from days 21 to 100, which is 80 days of additional coverage at $164.50 every day. So those are the things that are covered, and that's what it looks like financially. So that's Part A, hospitalization. Now, Part B does have a premium. It's not free. 95% of all people will pay $134 if they begin their Medicare in 2017. You'll notice that there's a plus sign after that, and this just simply means that 5% of the population is considered to be high income by Medicare, and anyone that's considered high income above $170,000 would have to pay more than the $134. And those additional amounts are called IRMAs, income-related monthly adjusted amounts. We just simply call them a surcharge. And so if your income is above $170,000, then you would pay more than the $134. But for today's session, we're going to keep it right here for 95% of you that will just pay $134. Your Part B premiums will be deducted out of your Social Security check if you're receiving Social Security. And if you're not, Medicare will bill these to you on a quarterly basis. So Part A is no cost, Part B $134 a month. Now, again, there's no networks, so you don't have to be concerned if your doctor is in the HMO or the PPO network. Original Medicare has no network. So as long as that doctor or that surgeon takes Medicare, then you are eligible to go to that doctor. As far as services covered, everything that would be related to outpatient services. This would be lab work. This would be MRIs. This would be outpatient surgery, maybe cataract surgery or something like that. So anything outpatient, B will pay the bills. Doctors and specialists that you go to see in their office or they come to see you in the hospital, Part B will pay the bills. Home health care, this would be follow-up typically after an outpatient surgery. The home health care agency then would be paid through the B system if it started during an outpatient type of procedure. Preventive services, each of us have eligible services that we can expect the insurance company to pay, and so in this instance, it's going to be Medicare paying for these. Right now, those of you that have an individual plan or a group plan, you're able to get certain services every year on an annual basis, and the insurance company pays for that at no cost to you. When you go on Medicare, Medicare B will pay for all your preventive services. And then lastly, durable medical equipment. This would be things like CPAP machines or oxygen equipment, or if you're an insulin-dependent diabetic and you have an insulin pump or maybe test strips, if you have a scooter or a wheelchair or a walker or a bed in the home, all those items are considered to be durable medical equipment, and Medicare B will pay the bills on that. All right. And so financially, what B looks like is we have a deductible. Fortunately, this is an annual deductible. We call this a calendar year deductible. So once a year, you'd be responsible for $183 for anything that would be related to the B services of Medicare. After the deductible is met, Medicare is an 80-20 plan. They're going to pay 80% and you're going to pay 20%. Now, as a reminder, for Medicare to pay their 80%, whatever you're having done must be deemed to be medically necessary. Okay, now your doctor has some say-so in that, but primarily Medicare has a list of things that they say are medically necessary, and if it's on that list, they'll pay 80%, and you're responsible for 20%. Now, the problem with your 20%, which we call coinsurance, is the statement here. Your 20% is unlimited, meaning Medicare Part B does not set a max out-of-pocket. So your 20% truly just keeps going and going and going. There's no limit to it whatsoever. And then lastly, within the Medicare system, there are some physicians that will see Medicare patients and will bill Medicare. However, that physician has not agreed to accept the Medicare-approved amounts as payment in full. And these physicians actually can add something extra to the bill called an excess charge. So here's the way this system works. There are two types of doctors. One type of doctor is called an assignment doctor, and the other type of doctor charges excess. Now, the assignment doctor is a doctor that accepts Medicare-approved amounts for the services rendered and will not bill you anything beyond that amount. In other words, payment in full based upon the Medicare-approved amount. The excess charge doctor says, no, I'm not going to accept that as payment in full, and that doctor can charge up to an additional 15% above the Medicare-approved amount, and when those charges occur, it's your responsibility. In other words, Medicare allows them to do it, but you have to pay it. Okay, and so here's a summary of Part A and Part B. Again, the financial, we have the deductible, we have the daily copays for extended hospital stays, daily copays for extended skilled nursing stays. On the B side, we have the deductible, again, just once a year. Medicare pays $80, you pay $20. Your part is unlimited, sky's the limit on that, and then the possibility of you paying an excess charge. And so these are your responsibilities financially, all highlighted here on the screen. Now, the majority of people that decide that they want to stay in the original Medicare system are going to get a supplemental plan to fill in those items that you're responsible for. And so the primary two plans right now that are purchased throughout the country are plans F and plan G. Those are the two plans that will fill in the gaps. Now, the F plan will fill in all the gaps that I just taught you about. All three on the A side and all the three on the B side, which means you should never, ever have to pay a bill. So as long as Medicare pays first, meaning you're having a service that's Medicare approved, then the balance of that bill will be paid by the Medicare Supplemental Plan F. The difference on the G plan is that it will pay everything on the A side, but on the B side, you would be responsible for the B deductible, this year $183, and then Medicare would pay the 20% coinsurance and all excess charges whenever they occur. So again, those two plans are very similar. The B deductible is your responsibility on the G plan, and along with that, you would have then a lower premium for the G plan. Right now, especially in most markets, that difference in premium between the F and the G will be more than enough to pay for your $183 deductible. Okay, and so let's summarize the two options that we've looked at so far. Number one, we have original Medicare A and B. That's A has no cost, B has the premium this year, $134. In addition to that, you'll pay for a supplemental plan to fill in the gaps. F fills in all the gaps, G fills in all the gaps but the B deductible, the $183 this year. And then in addition, you have to have a standalone drug plan, which I'll talk about next. But those drug plans are not included in A or B or the supplemental plans. It is totally a separate plan. The main difference between prescription drug plans with Medicare and those that you have been on your individual plan or maybe your employer group plan is that your group plans and individual plans have one stage, and that stage is you pay a copay. So when you go to get a prescription filled under that group plan or that individual plan, you get the prescription filled in January or July or December. You just simply pay a copay, maybe $20 or $30 or $50, but you just pay the copay regardless of when you get that prescription filled. When it comes to Medicare, it's not such an easy system. Medicare has 4 stages, and these stages begin when you go on Medicare, and then they reset every January 1st. So I'm going to explain these stages because until 2020, we will have 4 stages to contend with on every drug plan that's available. Okay, so stage number 1 is what we call the deductible stage. Medicare establishes an annual deductible, and you may or may not have to meet that deductible depending upon the plan that you're on. Stage number 2 we call the initial coverage. This is a place where you just simply pay copays for your medication. What's happening is the retail cost is established, you pay a small copay, and then the insurance company pays the difference between your copay and the actual retail cost. Stage 3 is called the coverage gap or the donut hole, and this is the stage where you will spend more money out of your pocket. In other words, this will be above and beyond the copays that you were paying in stage 2. This is the stage that no one likes. And then stage number 4 is catastrophic coverage. Here, medications are very, very reasonable, and no one is troubled by being in this particular stage. So let's go through these 4 stages. So stage number 1, the annual deductible is established by Medicare in the Medicare bill each year. This year, 2017, the annual deductible for Part D plans is $400. However, there are some of the plans that if you are taking a generic Tier 1 or Tier 2 medication, they waive the deductible. If you're on a Tier 3, Tier 4, or Tier 5 medication, then you typically have to pay that deductible out of your pocket. And so again, this $400 either is paid out of your pocket or it's waived by the insurance company. So that's stage number 1. So once we've satisfied the deductible out of our pocket or it's been waived, then we go to stage 2. And this is the copay stage. And again, this is a place where everyone's happy and everyone's very comfortable because we're just simply going to pay small amounts of money for our medications. And the insurance company pays the difference up to the retail cost. So you can see, depending upon the tier of the medication, what your out-of-pocket copay will be. Now, while you're getting prescriptions filled, what is happening is kind of behind the scenes, Medicare is tracking the retail cost of your medication. Again, when you're on an individual plan or an employer group plan, you were never concerned about the retail cost because it never affected your life. But when you go on Medicare, the retail cost will matter because Medicare is tracking that. So as we're in this stage 2, as they track the retail cost, once we reach a certain number, we call this the threshold. And in 2017, this threshold is $3,700. So if total retail cost, now remember, not your cost, but the total retail cost of this medication as determined by the pharmacy, if that ever reaches $3,700 in total of all your medications, then you're going to move to stage number 3, which is called the coverage gap or the donut hole. Okay, now it is here where the pricing structure changes. No longer are you just simply going to pay a flat, small copay. Now you're going to be paying a percentage of the retail cost of the medication. So the generics, you pay 51% of the retail cost. On the brand names, you pay 40% of the retail cost. Now, generics are very low cost, so it's not a very big deal with generics, but it can be a large deal when it comes to brand name medications because you're going to pay the full 40% of the retail cost of that medication. And what is happening is now you're going to stay in this stage until total out-of-pocket cost reaches $4,950. That number has nothing to do with the $3,700 number that we saw in stage 2. This is a brand new number. And what is in this $4,950 is everything that you have spent out of your pocket in stage 1, the deductible, and then stage 2, all your copays. So all of those go into $4,950. And then your percentage, the 51% of the generics that you're spending, or the 40% of the brand names that you're spending. All those out-of-pocket costs are going into the $4,950. So that's kind of the bad news. Now, the good news is all that money in the $4,950 is not yours because Medicare says if you're on a brand name medication, the manufacturer must discount that medication 50%. And that 50% discount, that amount of money, is also credited into this $4,950 number. So yes, it's large and yes, it's painful, but all of that is not necessarily your money because you do get the credit of 50% on the brand name medications. So once we reach that number, if indeed we do, then we go to stage 4, and this is called the catastrophic coverage. And again, this is not painful. Medications, you can see, you're going to pay the greater of 5% of the retail cost or just flat copays for generic and brand name medication. So those are the 4 stages on Medicare drug plans. And these 4 stages are in every single plan that's available. All the standalone plans and all the Medicare Advantage embedded drug plans have these 4 stages. Okay, so again, let's review. This option number 1 of the 2 that you have to choose from is to stay in original Medicare A and B, have a supplemental plan, and a standalone prescription drug plan. So these someone who goes in this direction is going to have 3 different cards that they're carrying in their wallet or in their purse to take care of their insurance needs. Now, option number 2 would be an Advantage plan. These are also called Medicare replacement plans. And when we go this direction, again, we'll have drug coverage that will be included in the plan. And all the same rules that applied on the stages with the standalone drug plans also apply in the embedded drug plans that are in the Medicare Advantage plan. So we can never get away from those 4 stages until 2020 when Medicare changes the system. All right. And so let's talk in detail about the Advantage plans. Number 1, you have to be enrolled in A and B of Medicare. Again, A is free, B has a premium. And so you'll have to pay your Part B premium. Either it's deducted from your Social Security check or they'll bill you on a quarterly basis for that. Now, one of the big differences between Medicare supplemental plans versus Advantage plans is this. You will always have a network when you have an Advantage plan. The networks are HMO and PPOs. HMOs we describe here on your screen with a smaller box because there will be less choices. There will be less doctors, there will be less hospitals, less specialists to choose from on the HMO plans. PPO plans, we have a much larger box, and so we have more choices, many more doctors and hospitals and specialists to choose from. one of the other differences is some of the HMO plans require that you have a referral from your primary care doc before you see a specialist. None of the PPO plans require that at all. You can go to any specialist in the network without a referral. Another difference between these two plans is that on the PPO plans, you have out-of-network benefit. Okay, you can go out of network by choice. So if you like to go to a provider that's not in the network, you feel free to do that. As long as they take Medicare, you can go there. And the PPO plan will pay 55% of the bill, and you will be responsible for 45% out of network. And then your max out of pocket out of network usually stops at $10,000. Now, if you're on an HMO plan, you cannot go out of the network unless it's an emergency. Okay, so on HMO plans and PPO plans, you can go out of network anytime, anywhere in the world. This would be emergency care or urgent care, and you're not billed as though you were out of network. You may be out of the network, but they'll bill you as though you were in the network if it's urgent care or emergency situation. All right. Now, as far as Advantage plans goes, they're also structured differently financially, and that is they do not typically have deductibles. So as we had deductibles on the A and B, those are eliminated. On the Advantage plans, we have no deductible. What you will do is pay copays for everything you do. We had very few copays in original Medicare, but with Advantage plans, you pay a copay for every service that you get except for preventive services. And then there will be a limit to that, though. This year, the limit is between $4,900 and $6,700 maximum out of your pocket. And so it doesn't matter if the bill's $1 million. You would never pay that. You simply will pay the max out of pocket established for the plan for that year. Now, we're going to give you a sample of the copays. If you see a primary care doctor, depending upon the plan that you're on, you'll pay somewhere between $5 to $25 for a primary care doc visit. Specialists will cost you $40 to $50 per visit. Urgent care situations going to be $30 to $50 for a copay. Emergency room somewhere between $65 to $85 in copay. Outpatient surgery, which would be like cataract surgery or maybe a non-emergency gallbladder surgery, something like that, you would pay $275 to $400 to have that procedure performed, and that's going to cover the facility fee. It'll cover the surgeon, it'll cover the anesthesiologist, and also the nursing services. So a very, very small copay for those outpatient surgery situations. If you have an MRI or a CAT scan or a PET scan, each of these tests will range between $250 to $400 depending upon the test and the location of the test. Outpatient rehab. You go to some kind of therapist, and each visit would be $40 to $50. And then all your labs and x-rays, if they are preventive, they're zero. The Advantage plan will pay for them. But if it's non-preventive, kind of diagnostic type situations, then you would pay up to $50 for your lab work and your x-rays. And then we have hospital copays. You'll remember that there's no deductible on Advantage plans. So like on the original Medicare, you had a deductible as your portion for the hospital. On Advantage plans, you just simply pay a daily copay up to a certain limit. Most of the plans stop after 5 or after 6 days, and there's no cost after that. So the first 5 to 6 days will be a daily copay of $275 to $335, and that amount of copay will cover every service that you receive while in the hospital that day. So it's just a flat copay regardless of the extent of services that you need. Everything will be covered for that copay. And again, they're tracking the total, and once you reach your max out of pocket, everything will be covered at 100% for that year. All right, so those are the sample of the copays. Now, what I want you to see is that when you look and consider Medicare Advantage plans, what they're doing is actually replacing original Medicare. You can't have both. Either you stay in the original Medicare system or you go on an Advantage plan. All Advantage plans will have one of two networks, HMO or PPO networks. Again, HMO typically less choices, PPO many more choices. And then you'll have copays for every service that you receive until you hit your max out of pocket established by the plan for that year. And then every plan will have within it an embedded drug plan. All right, so those are Advantage plans. And so, again, we see our options. We stay in original Medicare A and B with a supplemental plan and a standalone drug plan, or we get in a replacement plan called a Medicare Advantage plan that will also include drug coverage. So those are the two options that we have. And so let's kind of compare these two side by side. Number one, if you take a supplemental plan, you're going to pay higher monthly premiums. You're paying your A and B, you're paying your supplemental plan premium, as well as your drug plan premium. Medicare Advantage plans are much more lower cost on a monthly basis as far as premiums are concerned. In fact, many of the plans are, $50 or less for the plan themselves. themselves plus your Part B premium. So you're going to spend less out of pocket for the premiums. Next, the supplemental plans, of course, are more premium-based versus Advantage plans where you just pay as you go through your co-pays for all the services that you receive. And supplemental plans, basically after you've paid your premium, you really have little to almost no out-of-pocket expenses. Remember, the F plan, you'll have no out-of-pocket because F is going to cover everything that Medicare didn't first pay. Right? And the G plan, you pay only the $183 out of your pocket. So again, very little out of pocket other than your premiums. Medicare Advantage plans, again, we're paying as we go for every service that we receive up to the annual maximum out of pocket. And then Medicare supplemental plans will have a drug plan that will be separate. It's not included in the supplemental plan, so we have to select one from those plans that are available in our area. Most areas have somewhere between 20 to 25 drug plans to choose from. They're standalone. They have a separate plan, separate policy. Advantage plans will have the drug coverage embedded within, so you don't have to purchase a separate plan. It will be already included. And then if you take a supplemental plan, that plan will be written for life, which means you can keep that for as long as you want to. The insurance company can only change the premium. They can never change any terms of it. You get to be covered by that plan for the rest of your life if you choose. Not so when it comes to Advantage plans. Those plans are only good for a year at a time. The insurance companies can change the details of the plan, and therefore you also can change plans on an annual basis as well. All right, and so all of you are going to decide one of those two paths. You're going to decide to stay in the original Medicare system, supplemental plan, drug plan, or you're going to get a replacement plan, an Advantage plan with a drug plan. And then you're going to have to decide the path of finding the best plan for you. And again, there's just two options. You can choose to use what we call a captive agent. And a captive agent is an agent that just works for one company. Usually they're the employees or the independent contractors of just one company. Or you can go what we call the independent broker, and that's exactly what our firm is. And the big difference is if you go with a captive agent, they represent that company and their product portfolio only. And sometimes that can be quite limited. If you decide to go with an independent broker, then brokers like us will have contracts with multiple carriers, and then you have every single option available to you. So really, in essence, with a captive agent, you have very limited options. And with an independent broker, you have unlimited options. All the plans that are available in your particular market will be available through the independent broker. So those are the differences. So you have to decide which path is best for you. Now, what you need to know about either one of these paths is the price is always the same. You see, the cost to use a captive agent to you is absolutely zero. The insurance company will pay the captive agent's commission. The cost to use an independent broker is, again, absolutely zero because the insurance company, again, will pay the broker's commission. And so whether you use a captive agent or an independent broker, the price is always the same. No consultation fees, no commissions out of your pocket, and there's no upcharge for your insurance. So the price is always the same regardless of the path that you choose. All right? And so in summary, what we want you to understand is that as you begin to go on Medicare, we know that you want that experience to be enjoyable because Medicare can be intimidating, it can be confusing, and can be very frustrating. And folks, we have personally dealt with thousands of people, and so we really want that experience to be enjoyable for them, that they'll have peace knowing they made the right decision. And so if you decide that you want to work with our company, we call this the Enlighten You experience. And here's how it works. In order for us to recommend plan options for you, we need to gather some information so that we can do our homework so that we have our meeting. We can really look at everything available to you in our market. Number one, we're going to need all your name and, of course, contact information, where you live, what county you're in. And then we need details such as who is your primary care physician or maybe the specialist that you use. We also want to know what hospital would you like to use. We really prefer to have 2 or 3 hospitals as options for you. And then pharmacies. Where do you want to get your prescriptions filled? And then we want to know all the details about your medications, the actual name. And by the way, we don't want the brand name if you're taking the generic. And if you're taking the generic, we don't want the brand name. We want exactly what you're taking. We want the exact dosage that you take, how many milligrams, and then the frequency. How often are you taking that medication? Once a day or twice a day or as needed. And so those details we need. In addition to that, we also want to know about your current work situation, and your retirement status or your retirement plans. We know some people are going to work for a few more months or maybe a few more years. And so we need to know all the details about that so we can determine and advise you when you need to be going on Medicare. We also want to know about options that you have through your spouse and your spouse's insurance plan. So we like to know a little bit about that situation. And then your current insurance, who has you covered and what does that plan look like? And is that available for you as you go on Medicare? So those things we want to know before we meet. And then your Medicare eligibility, the date you're eligible, your status of enrollment, and those kinds of things help us to know how to advise. And then what's going to happen is then our research department will enlighten you. Folks that are very highly and very well trained will compare all the plans in the Kansas City metro area, and so that we can look and find for you the very best plan for your specific situation. We always say it this way: one size does not fit all in the Medicare business. There are multiple choices, and so we want to know all these details so that we can make the recommendations that will fit your specific situation. Now, folks, we get testimonies all the time from people that have enjoyed the Enlighten You experience, and this is just a sample of one. This came in from a gentleman out of Lenexa, Kansas. And here's what he said. He said, "I'm pretty good at researching things." He says, "It took me a long time, but I finally felt like I knew what I should do about Medicare. After I watched your first webinar, I hesitantly then signed up to work personally with Enlighten You. On the day of my consultation, I almost didn't go, but he says, I'm glad I did. The gentleman, that would be one of our agents who helped him, brought up 3 or 4 points I'd never considered and frankly knew nothing about. He says, in the end, I've been even better coverage than I originally was going to get on my own, and the process was so incredibly easy and hassle-free, plus I saved about $1,600 a year. And folks, we get these kind of testimonies all the time as people go through the Enlighten You experience. Now, if you decide that you do want to work with us, we call it the 5-step process. Number 1, you have to reach out to us. Okay, we're not going to call you. We're not going to bug you in any way. You have to reach out to us and say, I would like to use your services and to go through the Enlighten You experience. And so you have to click on the Get Started button, and you can do so on this page right now, and we'll start the 5-step process. Number 2, after we've heard from you, then we're going to do all the research. Now, folks, if you try to do all the research on your own, some of you are going to spend 2 hours, 10 hours, 12 hours, 20 hours. You're going to spend a lot of time doing the research, or you allow our group of trained people to do this work for you. Number 3, then we will set up a free consultation. This is a time in which we're going to review every single option available to you in this market. And how we prefer to do this in our office. We think it's well worth your time to do that. We think it's very important that we take the time and really focus on all these options. So we like to do it in our office. There is a picture here of the building in which we're in at College in Metcalf in Overland Park, Kansas. We're on the 5th floor of this particular building here. It's called the Lighten Tower, and so we're have offices on the 5th floor, and we'd be happy to help you. And so we'll do it either in our office, or if you prefer, because of scheduling or whatever, that we can do it by phone, we're fine to do that. We, of course, would have to email you some things so that you'll see everything, but everything can also be done by phone if that is your preference. Either way, we'll do the review. And then number 4, once you've decided upon the plan that really is the best fit for you, then we'll take care of all the red tape and make sure that everything's set up properly for Medicare and the proper insurance plans as well. And then lastly, and this is something that really sets us apart, we assign to you a relationship manager for life. You know, if you have a call center or a captive agent, you have no idea who your agent's going to be from year to year to year. Well, with us, we assign an agent to you that will be yours for life. That agent will be your advisor and will be your advocate if you have any kind of problems. And I tell people all the time, when we do an enrollment, we do not see it as though, thank you very much, see you later, have a good life. We know that this is going to be an ongoing relationship. And so we make sure that you know exactly what you need to do each year during open enrollment. And if you have any claim problems or any kind of issues that will occur on the plan, our relationship manager will take care of those things for you. All right. So if you click Get Started, here's what's going to happen next. Number 1, you'll be taken to a very simple sign-up page to enter your contact information. And I promise you, this information is only in-house. We'll never sell this. We'll never give out any of your information whatsoever. I promise you that. And so we need to enter the contact information. Number 2, then an Enlighten You representative is going to reach out to you and get the following information: all your prescription medications, your primary care docs and specialists, your hospital preferences, pharmacy preferences, insurances, and any other pertinent information that we feel like will help us to be able to give you the proper advice. And then our team, again, will go to work for you, and we'll check out all your Medicare options within the Kansas City market, and then we'll set up an appointment for you to meet with us in person or over the phone if you prefer, and then we'll go through all of those options so you're clear as to what your choices are. And then when it's ever necessary, and it is often, we'll even take care of the Medicare enrollment, all your surcharge forms, every application that's necessary so that everything is completed in a very timely manner to ensure that you have the right coverage at the right time. Now, it is not uncommon for people to say, well, I'm not really sure if I need to start Medicare yet. Well, here is our suggestion. Just click here where it says schedule a quick phone call. And what's going to happen, you're going to be taken to an online calendar of ours, and you can schedule a totally free 15 to 20 minute call with the Medicare expert. And some of you are contemplating it. You're not sure exactly if you should do this or shouldn't do this. And you really don't want to come in yet for a consultation and tell us about all your meds. You just simply want someone to give you some advice. Folks, that's what this is for. We have people all the time that call us and just need a little bit of direction to determine if they really are ready for Medicare or not. Now, I know you can call Social Security and wait on hold for an hour, or you can call different people, but sometimes you do not get accurate information. And I promise you, this phone call will be with a Medicare expert, someone that will answer your questions very promptly and very accurately so you can make a decision about Medicare. So again, schedule a quick phone call if that would be in your best interest. Now, if you want us to help you, please click the Get Started button to begin right now, and this is what is going to happen. Number one, when you click the button, it's going to take about one business day, and then what will happen is our office manager within our company will call you to book that free consultation. And before the consultation begins, of course, we're going to gather the information that we need from you, and you'll get an email from us and all the details that we're looking for. It'll take about 2 or 3 days or so, and then you will submit that information form for our research team to begin to do their work. All right, it takes them anywhere from 3 to 5 business days, and that then allows us to set up for the consultation with one of our Medicare experts, and then we can review all the options. And once we've done the enrollment into Medicare and we've got all the insurance plans set up, then it's going to take about 3 weeks or so for your Medicare card to show up and your insurance coverage to also show up as well. So you have your cards and your coverage so that everything will begin very, very seamlessly. All right, so that's the timeline when you go through the Enlighten You experience. So if you want us to help you, again, please click the Get Started button to begin. And I want to thank you so much today for joining with us during this session because it ultimately boils down to that decision. Are you going to stay in original Medicare and get a supplemental plan and a standalone drug plan, or will you go with an Advantage plan? And so remember that $560,000, folks, that's a lot of money. And so we want to make sure that you make the right choice so that money is coming out of the insurance company's pocket instead of yours. Thanks so much for joining us.